Welcome to the Egg Whisperer Show. I'm thrilled to have Dr. Nitu Bajekal on today's show. Welcome, Nitu.
Thank you. Thank you so much, Amy, for having me. I've been listening to your podcast and I just love everything about it, especially the name, the Egg Whisperer. Fantastic.
Well, you have quite the name too. Your patients call you Dr. Magical Bajekal, and I think you are magic with all the things that you're doing.
Thank you.
For our listeners and viewers who don't know you yet, I'd like to share a little bit about you. Dr. Bajekal is a senior consultant, obstetrician and gynecologist in London with nearly 40 years of clinical experience in women's health, specializing in lifestyle medicine, menopause, PCOS, endometriosis, and complex vulval issues. A skilled keyhole surgeon, she's experienced in laparoscopic procedures, including robotics. Dr. Bajekal is one of the first board-certified lifestyle medicine physicians in the UK and a fellow of the Royal College, receiving the Indian President's Gold Medal. She co-authored Living PCOS Free and has a new book that we'll talk about today, Finding Me in Menopause, focusing on perimenopause and menopause care. Passionate about education, she provides reliable health information through her website and runs a voluntary service to empower women and girls to improve their health through lifestyle choices. Welcome again, Nitu.
Thank you. Thank you, Amy. Such a long introduction. Someone think, is that me?
First of all, your family must be so proud. And when I saw that you wrote Living PCOS Free with your daughter, I was so touched by that because I hope one day that I get to write books with my family as well. But let's get into some of these definitions because I don't feel like women know enough about what is perimenopause. How is it defined? What is menopause? So can you talk to us a little bit about that?
Of course. The term perimenopause can come with a little bit of apprehension and concern because it has the term menopause attached to it. But perimenopause means the time around your menopause. So let's start first with the definition of menopause, which is basically when a woman completely stops her period, and it's a retrospective diagnosis, which basically means that you look back and you haven't had a period for 12 months and you're now menopausal. And women often will think, that's the end. I'm menopausal for 2 or 3 years and I'm now through menopause. You actually remain in menopause until the day we die. And with life expectancy increasing, that's about 3 decades. So there's a lot we can do to empower women much earlier on so that we can actually have our best lives. But menopause, historically, people will always say, oh, you'll be in your 50s. The average age of menopause is 51 all over the world, 51.4. But actually, that's not necessarily true. The range is between 45 and 55, Amy. So what happens is if you ask, for example, a woman from the Indian subcontinent, a Southeast Asian, or if you're from the Afro-Caribbean community, your periods may actually stop much earlier. So, for example, we know women from certain parts of India will stop their periods around 45, 46, 47, much earlier than the 51.4. And some women will go on till 55. It's, of course, a range. So not everybody will stop around that time. But perimenopause is the time leading to menopause, is the time that is 2 to 8 years before you completely stop your periods, when your egg reserve starts dropping. Because what is menopause? You're born with almost a million eggs at the time of birth, and then they start diminishing slowly but surely. And by 35, by 37, there's a steep decline. So what happens is perimenopause, when the number of eggs drop below a critical level, say about 1,000, your periods stop. But that changes start occurring 2 to 8 years before. So women may notice shortening of cycles. They may start skipping periods. And then if you have background conditions like polycystic ovary syndrome, for example, you might get confused as to what's actually happening because there are no real good tests for diagnosing the perimenopause. And that might be the first time you're thinking, maybe I need to start a family. Maybe I need to freeze my eggs. Maybe I have just sorted my career out. And you're 35, 36, 37. You haven't asked if you have access to your mother, or if they're willing to tell you, your mother, your grandmother, then maybe you'll have some inkling as to when their period stop, because there is some correlation. But the truth is, a lot of women at 35 and 36 and 38, which is the common age in the UK, and I'm sure it's the same age in the US, when they're thinking about egg freezing, they've send off a test in the post to do their AMH, and then they get back a result and they are absolutely horrified because those levels are low, because they are not expecting that. They have seen a whole lot of celebrities having their babies in their 50s, and there are many ways of having a baby, as you know, and it's not necessarily always with your eggs. And so, you and I are here to educate people so that if they are wanting to build that family with their own eggs, we want to educate that perimenopause may start 2 to 8 years before you're destined to stop your periods. And you actually don't know when your periods are going to stop. So that may happen in your late 30s. And, being aware, knowledge is power. So I just wanted to bring that in as to what perimenopause is, time leading up to menopause.
And that is so important because it can be so scary, just like you said. And getting that diagnosis makes a woman feel like there's something wrong with her. And the reality is that's just normal reproductive human biology. It's just part of life. And if we embrace it as such and understand it, then you're not rushing to the doctor, calling, saying, I skipped my period. I'm so scared. There's nothing scary about it. I mean, I can understand emotionally it's scary, but it's actually quite normal.
Yes. I mean, it is quite normal. But as I said, if you are somebody who hasn't really finished completing your family, or if you have other medical conditions, you might think it might be your thyroid or PCOS and things like that. So being aware, but also not falling prey to a lot of, as you know, there are a lot of tests that people are doing, urinary assays, salivary assays. Sadly, those are not of help to diagnose perimenopause. It's a clinical diagnosis.
Right.
So you may notice a bone loss, you may notice a lipid changes, cholesterol levels may drop, but also lowered mood, lowered libido, not wanting to have intercourse when it's quite important, especially if you're trying to conceive. And of course, you must check for pregnancy as well if you're missing periods. So it's a lot of things that people have to remember, but you must not be scared. Knowledge is important.
And menopause is not a dirty word.
No.
I think of it as me, no pause. I'm not pausing. I'm continuing on in life.
And I literally feel 25 in my head, although my periods actually stopped, very many, many years ago.
So let's talk about your own experience with early menopause. And you do talk about it in your book, Finding Me in Menopause. Can you talk about how your own personal journey informed your decision to write this book?
Yes. Actually, I was about 38 and I had just started applying for what is known as the top tier jobs in the UK. You're becoming a consultant, you're flying solo. And I thought I was stressed. I had a young family. I was very busy. I was also being bullied. So when I started missing my periods, having always had clockwork periods, I thought this was, despite being an OBGYN, I thought everything other than menopause, because my mother and sister had their periods into their 50s. And so while family history is important, it's not the only thing. And of course, when I did become menopausal, I was not even 39. And it was quite a shock having, first of all, to come to terms with that diagnosis. But also, Amy, in 2000, what happened was there was a lot of information that came out from the WHI study and the Million Women study, which basically meant that our family physicians refused to give HRT. And for anybody who's listening, if your periods stop under the age of 40, it's a medical condition called POI, which is premature ovarian insufficiency. It used to be known as premature ovarian failure, but we are not failures. Our ovaries have not failed us, so it's known as premature ovarian insufficiency, and it needs medical specialist input. You can't just see your family physician. You need to be referred. Up to 4 women in 100 will actually go through early premature ovarian insufficiency, and 1 in 20,000 under the age of 20. And between 40 and 45, it's early menopause. So there are quite a large number of women who are having all these conditions, and HRT is one of the cornerstones for managing this. But when I should have been given HRT, the guidance had never changed. Anybody under the age of 40 should have had HRT, but family physicians got very scared, and many gynecologists as well. And at that time, was surrounded by male colleagues, and I didn't have the confidence. I had just started my job, and I wanted to be the best laparoscopic surgeon, the best everything. You know how it is. And in retrospect, they would have been actually very kind to me, but I wanted to prove myself first. So I had to cope without hormone replacement therapy. And I was having panic attacks and anxiety and all the things. And it was good. I had a supportive family, but I really couldn't share a lot of things with people. And I just wish that the book that I have written now was available to me then. And that's why one of the driving reasons why I'm active at 62 on social media, as well as writing these books when I should be, you know, on the golf course. So,
Well, you still have a lot of work to do. So
yeah.
thank you. A lot of work to educate because menopause is kind of like puberty. No one teaches you about it when you're a little girl. All of a sudden, you get a period, you don't know what's happening.
And it's also a lot of doom and gloom. And I don't want it to be doom and gloom. Yes, for some people, it can be a very hard diagnosis, especially when you're very young. But for the vast majority, it isn't. And I want people to realize that there is life after menopause and there's a lot of things that you can do. And I just want to take away that constant negative thing because if you think about women in their menopause, once they've hit 50s, we only use negative words for them, except until they become a grandmother. And not everybody wants to be a grandmother. Not everybody has to be a grandmother. And there are so many other things we can do, you know?
So, I want to talk a little bit about the impact of nutrition and lifestyle. And
Yes.
you shared that you were not taught about that. I wasn't really either. The impact of both those things on illness as a medical student in medical school. Why do you think it's taken so long for Western medicine to embrace lifestyle medicine?
I think because it's again having the knowledge and having the information. We have had the science, but if you look at over the last 20 years, there's so much progress being made. And I'm very pleased to see that more and more people now we have the American College of Lifestyle Medicine, the British Society of Lifestyle Medicine. There are lifestyle medicine colleges all over the world now and people are realizing the importance. You see, before we put a lot of reliance on pharmaceuticals, which have a definite place, but it's never too early and never too late to learn about your own health. Because it's one thing where the person, the patient, or the woman, or you and me are in the driving seat. That means you are controlling your destiny to an extent. And in the normal situation when you are doing your egg transfers, IVF cycles, and I'm doing my surgery, I'm in the driving seat as the doctor. But in lifestyle medicine, you actually have the patient in the center deciding, I want to sleep better. When I sleep better, my inflammation reduces. I stress less. When I stress less, then I tend to want to exercise and move my body. When I want to move my body, I tend to eat that apple rather than the donut. I want to then pick up the phone and talk to my friend and have a good laugh and keep away from that alcohol. We know that there are 6 lifestyle pillars and you don't have to only focus on nutrition because if you just do one thing, it's not going to have all the benefits, but choose one of the lifestyle pillars that you can start with and then slowly good habits. It's not like you're suddenly not going to the gym and picking up 150 kilos of weight. You're going to do it first. You're going to do your 10 kilos and then your 20 and then slowly build it up. The same thing with lifestyle changes. Make little positive steps. And women, sadly, we have been told by society we are never too thin, accomplishing everything. So, what we have to do is learn to be kind to ourselves. I want people who are listening to this to take away that, you don't do this with judgment. Do it without judging yourself, just like you would talk to somebody that you dearly love. And so, if you do slip off the thing and you haven't been to exercise or you've eaten that entire chocolate cake, get back on track and start eating those beautiful fruits and vegetables and soy and all the other things that I always advise people to eat to improve their health, reduce their inflammation, improve the quality of their eggs, and improve and reduce their symptoms of menopause.
And you talk about the connection between plant based nutrition and women's health in your work. What role does plant based eating play in managing menopausal symptoms, according to your findings?
A huge role, actually. And when I mean plant based, some women or some people might choose to go completely plant based, and that is can be very beneficial, especially if you're trying to prevent or put them into remission. But with menopause, the earlier you start, for example, the earlier you bring soy products in. So if you eat a handful of edamame beans or a handful of tofu, and I usually recommend between 2 to 4 portions for adults. So, if you're working out quite a lot, have a glass of soy milk, have a handful of edamame beans, maybe some tempeh and tofu. A handful is a portion. So you want to eat. There's no harm if you ate 10 portions, but it would mean that you're not eating those beautiful fruits and those beautiful whole grains and beans and things like that. But we do know that plants contain phytoestrogens, especially soy and chickpeas and legumes and things like that. So we know that when you eat those phytoestrogens and you eat plant protein, you help to prevent loss of muscle mass. You also help to reduce menopausal symptoms such as hot flashes. Try and stay away from ultra processed foods like, chips and cakes and biscuits. They should be really meant to be treats, not to be eaten on a daily basis. What happens is you increase something called advanced glycation end products, which actually are called AGEs, AGES. They basically damage our tissues, our arteries, but they also damage our ovaries. So it's so important that the more plants you bring onto your plate, when you look down on your plate, you must see color. You must see lots and lots of color. So when you have color, you shouldn't overthink it. You should crowd out foods rather than thinking, this is bad for me, that is bad for me. No, you bring in things so that slowly the foods that are not bringing you health are pushed out of the plate. So plant predominant, plant based helps in every aspect of women's health, Amy. If you're preparing for egg freezing, if you're preparing for a pregnancy, if you're pregnant, if you are menopausal, if you're perimenopausal, if you're going through puberty or you're having painful periods or you have endometriosis or adenomyosis, we know that when you eat a diet that reduces inflammation in your body, when you do strength training, you reduce an insulin resistance. We know that these foods will help you optimize your health in every single stage of your life, in all genders, in everybody. So I can't stress enough that the more you can make these little changes, the better it is. It's incremental. You don't have to go suddenly jump to 10 portions of fruit and veg. You can start with one satsuma or clementine and a bunch of grapes and then some greens and then slowly build it up. And then you'll be happy. And I know that in the US, soy has a very bad press, but I really urge all the people who are listening that it does not affect fertility. In fact, it will help with things. It will help you get a slimmer waist. It will help to improve insulin resistance, heart health, blood pressure, all the things that can rear their heads, especially for women who are trying to conceive in their late 30s and early 40s, and of course in menopause. So I hope I've made the case for bringing in more color and more plants onto your diet, because there's a lot of focus on animal protein, but that you have to think about protein is very important, but where do you get it from? And you want to get it from your soy, from your beans, from minimally processed foods.
And then there's also a connection with your mood.
Yes.
Talk to us a little bit about that, about the physical changes during menopause and how that affects our mood.
Yes. So mood changes can, be there in perimenopause as well. And you might really think, why is my PMS symptoms getting much worse? What is actually happening? And you can go to the doctors, but blood tests won't show, because one minute your estrogen levels will be normal, next minute they won't be. And there's no way of picking that up. But if you are filling your plate with colorful foods, we know that they help to open up arteries, they improve mood as well. But exercise, and exercising in the open, for example, going for a brisk walk or doing strength training, we know helps to release endorphins. And when you do that, you tend to prioritize sleep rather than doom scrolling on your phone about with TikTok. We're all guilty of those things. But it is so, so important to prioritize sleep because it improves mood, especially in menopause and in lots of women's health conditions. Women who have painful periods, painful intercourse, difficult relationships, PCOS, sleep can be really disturbed. So we have to prioritize sleep to improve mood, because background conditions of endometriosis, which is a whole body condition, PCOS, which can cause anxiety, depression, OCD, these are all things that are very common. And these women also will become menopausal and perimenopausal. So we know that the way we sleep, the way we stress, the way we eat, the way we interact with other people, we build a positive community. So if you have friends around you that drag you down, they are frenemies. Keep them away. Have friends that lift you up. I'm very serious. Friends and family should be there to lift you up. They should not be there to drag you down. So if you are somebody who's finding that you're always not feeling good around people, maybe find some other ways of doing things that will help to lift your mood. So it is so important. And alcohol, we don't talk enough about alcohol. I know the US probably doesn't drink as much alcohol as the UK, but alcohol is a real downer for mood. You think it will, make you feel much better. That's very temporary. It affects your sleep, it affects your mood, it affects menopausal symptoms, it affects perimenopausal symptoms, it damages the ovaries, it increases our risk of breast cancer. 1 in 7 women in the US will get a diagnosis of breast cancer. So it is so important that we don't look at any of these things in isolation. And when people say, I just do it in moderation, remember, moderation kills as well. So you want to, there's no safe limit for alcohol and for tobacco smoking. So when you do it very mindfully.
Yes, I agree. I think the first thing is sleep. I agree with you. Second is cut out alcohol. It doesn't have to be completely alcohol free, but I mean, I live alcohol free. I don't know. Are you alcohol free as
No,
well?
I'm not completely alcohol free, but if I have a celebration, I will enjoy a glass, but I'm very mindful about it because I feel if there are certain things in my control that I hadn't drunk alcohol until I was 40. So don't ask me why I started drinking because especially with all the information coming out, literally the best amount of alcohol for you is zero. And I know I sound like a party pooper, but it is so, so important to take this on board because a lot of people wonder why their symptoms have got much worse. And as I said, some people can go along and their gut microbiome is able to tolerate eating lots of burgers and coffee and alcohol. But for me, I know if I drink alcohol after 12, I'm finished. I'm finished for the next 2 days. So you have to know your body as well.
Yeah, you call yourself a party pooper. I call myself buzzkill. So I'm buzzkill and you're the party pooper. But together with our sparkling personalities, I think we make up for it.
I love that. I love your sparkling thing that you mentioned in your podcast. It's so good. So good.
So I would like to touch on the work that you did with your daughter living PCOS free because a lot of my listeners are also dealing with PCOS. So I'd love for you to just plug your book and tell us more about it.
So PCOS or polycystic ovarian syndrome is so underdiagnosed, Amy. 3 out of 4 women will never ever get a diagnosis in their lifetime. And it affects at least 1 in 10 women. But many studies have shown that women who are from, again, the Southeast Asian communities, Black communities, they can actually have as high an incidence as 25%, 1 in 4. And those who are struggling with fertility is the most common cause of infertility in women and ovulatory infertility. And about 8 out of 10 women will also struggle with weight. It's a very complex endocrine disorder that is not actually a disease of the ovaries at all. So your listeners will be very interested to hear it's not a gynecological condition. What it is basically a hormonal changes that occur that works on the ovaries. And as a result, insulin resistance often is one of the background conditions, but not everybody has insulin resistance. But your ovaries then react. So there are 3 criteria of which 2 of them have to be met. One of them is missing your period. So long cycles or missing your periods for 3 months, that is not normal at any stage unless you're at the extremes of age for a little while. So when you just started your periods and when you're finishing your periods. Otherwise, if you're regularly having 45-day cycles, 50-day cycles, that's not normal. And that's because the egg is not getting released. All these little follicles rush to the surface and one queen bee has to be selected, and that one queen bee doesn't get selected and the egg doesn't get released. And so what happens is there's no ovulation, and so these cycles go on. So anovulation is one of the very important, or long cycles is a very important symptom. Then you can have signs of androgen excess, which basically means that the insulin itself can increase the ovaries, make them produce more testosterone and the adrenal glands as well. So women may complain of acne, adult acne, cystic acne, acne on their chest, back knee. They may have excess hair growth where they don't want it. They have hair loss. They can have all these symptoms of androgen excess, and sometimes blood tests will confirm that. And sometimes ultrasound scans, when you do your ultrasound scan, you may see this little pearl-like or pearl necklace type arrangement of these little immature follicles. There are no cysts in ovary in PCOS. They don't cause any pain. But what if anybody's having painful periods with PCOS diagnosis, you must look for coexistent adenomyosis and endometriosis. So it's so important to understand there are so many symptoms. And then there are sleep problems, sleep apnea, snoring. These can be real issues. There can be anxiety, depression, obsessive compulsive disorder, suicidal ideations. There can be psychosocial dysfunction. So intercourse can be a problem as well. So there are so many, I haven't even touched on weight gain can be an issue. And so increased risk of endometrial cancer as you get older. And so we know that it's a very complex endocrine disorder, but I don't want women to think that their ovaries are diseased. There's nothing wrong with your ovaries at all. It is a condition which is higher up in the brain. And so we can do things through diet and lifestyle. It's the first line of management. All the Royal Colleges will confirm that, including your American college, that eating a diet that reduces your inflammation, and in that word, plant-based eating and exercising, strength training, prioritizing sleep, stress, and reducing alcohol are big ways that your patients can actually improve their health if they have a diagnosis of PCOS.
Yeah. And I love that your book is how to regain your hormonal health. So it's really important for people.
Must get Rini over because she will actually explain things so much better because she's a nutritionist and she herself has PCOS. And so when I was trying to write a book, she said, Mom, why are you writing a book on anything else? I have this condition. I don't want you writing a general book, 2 pages on this, 2 pages on that. Let's write a deep dive. I want this book because nobody's written about this in such detail.
Yeah, that's true, especially in this way with someone with your background. So before we close, I just want to talk a little bit about some of these myths about menopause. And one of the myths are that if you're in menopause, you can't get pregnant. And I, specialize also in creative family building. And so women feel like if they've stopped their periods, there are no more options for them. So tell me about some of the myths surrounding perimenopause and menopause.
So women can get pregnant, but the fertility levels are very low. But that does not mean that you shouldn't be using contraception if you don't want to have children. So it's important to understand that once your periods stop and you're under the age of 50, you have to use contraception for at least 2 years because there is a chance that you might get pregnant. However, women should not be under the impression that it's easy to get pregnant like you would in your 20s. So, for people who have this family history, have been fortunate enough to find out what their grandmother or their mother or their aunt went through, it is useful to have that knowledge so that they can be then informed, okay, maybe I need to start building my family much earlier. But for in menopause, we know that if your periods stop after the age of 50, you need to be using contraception for a year because it is a retrospective diagnosis. So you may suddenly ovulate and you may get pregnant. Same thing with POI, premature ovarian insufficiency. Not everybody is completely infertile, but we would assume that their ovarian reserve is very much reduced, and so one should not be waiting for that. But yes, that's a big myth that you can never get pregnant, but it is important to build that up with a caveat. There's also this other myth that it's all doom and gloom, and you're never going to have a life again, and that's wrong. And the last thing I want to say is it's not just hot flashes and night sweats. They may be the common symptoms, but there are 34 different symptoms described. And so it's important to persist. Sometimes your health professional may not be knowledgeable. Even with PCOS, they don't join the dots. You go to see the dermatologist for skin conditions. You may see your dietitian for weight loss, and nobody's really talking to each other. And you, as the patient, I want to empower you to say, actually, I am going through perimenopause, or I am going through menopause, or I may have PCOS. And that is important because there are so many myths, and often you will get sent away. So there are lots of good doctors around, empathetic health professionals. Sometimes you have to see 2 or 3 people until you find the right person.
What's wild for me is sometimes patients, they see so many doctors, and it isn't until they see an acupuncturist that their acupuncturist is the one that connects the dots. And they say, and then they go to Dr. Amy.
And we have this notion that knowledge is only the jurisdiction of doctors, but actually, we have health professionals in so many different fields, somebody who's willing to listen, somebody who takes a good clinical history. That's all you need. You don't have to be a rocket scientist for this. So I just want people to realize it doesn't matter where you go for that help, but ultimately end up seeing either Dr. Amy or somebody who is actually going to help you, and that's why I also have, for people who don't want to buy my book, Amy, my books, I really want you to direct them to my website, because I have about 50 different fact sheets, all free. They don't have to pay anything at all. It's just nitubajekal.com, and they can go on there, they can listen to your podcast, they can see the teaching materials, recipes, but also on all the women's health conditions that we talked about today and many more. So I do want people to realize, because not everybody wants to buy a book, right? So I think it's important that the website is something the way they can all go on to and pick and choose whatever they want to learn about.
Absolutely. And I'll be sure to include the website in the show notes for those listeners who want to go there. Please do. And we'll make it easy for you to find. And I love that you say this isn't rocket science. So that's what I tell my patients too. This shouldn't be rocket science, right?
Oh.
I mean, these conditions have existed forever. And, if you just put the symptoms, believe it or not, into ChatGPT that you have, ChatGPT might make the diagnosis for you a lot quicker than the doctors that's just looking, for example, at your skin or yeah.
It is important for us to educate people so they can actually recognize the symptoms as well. And I have a whole chapter in both the books where I tell women what are the questions you should go ready with. You should not be then at that point thinking, when did my last period come? What is my menstrual cycle? What are my medical notes? Have all that and be that annoying patient with a big list of questions, because it's your body. Nobody loves your body better than you. So, you have this one body and you should look after it, and you should make sure that you get the best out of it.
Absolutely. And having your own records is so important. Patients think for some reason that I have access to every single doctor that they've ever seen. Well, that's just not how the world works. Well, Dr. Bajekal, you certainly are magical. And I am just so glad that the universe brought us together and connected us so that I can continue to have you on my show. And we will be doing this again. So thank you so much. Is there anything else you would like to share?
I have to say, I always share your stuff on my website, on my social media, Instagram and TikTok, because I know that so many women can't talk about many of the things that they're going through. All my patients, any of my fertility patients that I get, I always listen to the Egg Whisperers podcast.
Thank
Make
you.
sure you follow her because I
Thank
love
you.
it.
You're the
And
best.
I will
Thank you.
definitely have Rohini over, because I think your listeners will benefit.
And I'd love to meet her. Well, thank you for joining me.
Thank you for inviting me.